This is 7 National News, and in our top story. A 5-year health strategy has been launched to streamline the health sector in Dubai. The strategy was launched on Tuesday by His Highness Sheikh Mohammed bin Rashid Al Maktoum, the UAE Vice President, Prime Minister and ruler of Dubai, at a meeting at the Executive Office in Dubai. After approving the Health Strategy 2021, His Highness Sheikh Mohammed stated that the Emirate of Dubai is facing the challenge to improve healthcare services and rise to our ambitions and aspirations for establishing Dubai as a main medical destination in the UAE and the wider region, where 1 billion people are living around us. The strategy, aiming to revamp the health sector, features 4 main approaches, 6 objectives, 15 programs and 93 initiatives to achieve the leap required over the next 5 years. The 4 approaches include health and lifestyle, excellence in providing service, smart healthcare and governance. The strategy aims to achieve 6 goals, which include ensuring a healthy and safe environment for Dubai's people, ensuring the provision of a high-quality, comprehensive and integrated health service system, achieving innovation, improving efficiency in providing healthcare, and creating an integrated database to be used for the smart government policy in taking decisions. Other goals include creating an effective ecological system for the healthcare sector in Dubai in collaboration with the private and public sectors, in addition to restructuring DHA's administration. His Highness Dr. Sheikh Sultan bin Mohammed Al Qasimi, the Supreme Council member and ruler of Sharjah, has issued an Emiri decree establishing the Sharjah Media City Free Zone. Decree number 10 of 2016 stipulates the establishment of a media free zone, the SMC Free Zone, which has an independent legal personality with full financial, administrative and civil independence necessary to undertake legal actions. Its geographical resolution and borders will be determined in a decree issued by the ruler of Sharjah. The goals of the SMC Free Zone are to develop and embrace talent and manpower working in the media and creative fields, and the regional leadership in the field of creative media training, support the development of creative, high-quality media, and provide a favorable environment for the media and creativity by creating an attractive and sustainable city with infrastructure and world-class services, and at a reasonable cost, with the aim to enhance the Emirate's reputation in the creative and media fields by highlighting local content regionally and globally. Sharjah Media City will be managed by an executive body, including a president who shall be appointed by an Emiri decree. Dubai Health Authority has launched 9 new health regulations for improving the quality of healthcare in the Emirate and patient safety. The announcement of the new and amended regulations was made during the 4-day Arab Health Congress and exhibition, which started on Monday. According to the authority, the regulations are based on medical treatments, audit reports, as well as inspections of the healthcare facilities in the city. The announced regulations cover a range of medical treatments such as hair transplant service standards, scope of practice and clinical responsibilities related to family medicine and general practice, as well as a recommendation on more investments towards the field of oncology services. Due to the increased concern for issues such as sleep apnea and deprivation, the new regulations also include guidelines for investing in sleep labs. Commenting on the launch, DHA Director of Health Regulation at the DHA, Dr. Leila Al-Marzouqi, stated that some of these regulations have been updated to meet international standards in line with new medical developments.
What we need to do is we need to diagnose patients who have problem during the sleep, like they have sleep apnea or they have breathing problem during their sleep. We need to bring them into these labs and run a few tests on them and to see what exactly is the problem, and then based on this diagnosis we can offer them the best treatment that suits their case. Demand is there. Investors have come to us asking for this kind of facility, and experts in that field have come to us with these applications, and of course the need is there and the market is requiring to have such facility. That's why we developed such regulation to facilitate the work of the expert and to have a service for the local and the international patient who are coming to treatment in Dubai.
And UAE-based Aster DM Healthcare have announced the launch of their service called Aster at Home, which is aimed at meeting the medical needs of their patients in the comfort of their homes and round-the-clock monitoring. Representatives from Aster Healthcare added that the program is catered towards their patients with chronic illness such as diabetes, cardiovascular diseases and hypertension. As part of the program's pilot phase, patients are provided free gadgets to monitor their blood sugar and blood pressure levels. The results are then shared with the doctors via cloud technology, and should there be an unusual reading, the patients will then receive a phone call or a text message to visit the clinic immediately. Although the cost of this service has not yet been disclosed, the executive director added that so far around 100 patients have been provided this service, with a large interest expected over the next few months.
Typically what happens is you will have the patient getting diagnosed with diabetes, or you go for every 3 or 4 months to go see the doctor. He'll give you a plan, and then you go back and check in 3-4 months, and if you're good, or sometimes it gets stretched even beyond that. Here what we do is we monitor you constantly, so that 3 months, 6 months, whatever it is, every day or every other day, we make sure that we are keeping track of you on a daily basis. So the benefit of that is like we are constantly watching over you, even though we are not kind of encroaching. So we are hand-holding you through the whole process to kind of make sure you're on the right path. Because a lot of times you make choices, you make lifestyle decisions which you don't see the long-term impact. So here what we do is every day we are checking what the variations are, and we kind of steer you back on course without really encroaching on your space. So we are hoping that by doing this pilot, we've started with 100 patients right now. We will be able to see better outcomes, better management of both hypertensive patients as well as diabetic patients. So that's going to be a very significant project for us, because if we can do this, then it becomes a lot easier for patients to be managing these diseases for which typically last them for lifetime.
The 11th Annual Healthcare Insurance Forum opened yesterday with the impact of mandatory healthcare insurance dominating discussions throughout the day. The event, which brought together leaders in regional healthcare as well as health insurance providers, discussed improvements that should be undertaken to improve the quality and efficiency of medical provision across the region. One of the main issues identified by those participating includes the improvement of communications and the need for increased collaboration between the various healthcare insurance parties in the Middle East, as well as measures to reduce fraud and minimize costs. The local industry has gone through a number of major adjustments recently, particularly in relation to the impact that government regulations for mandatory healthcare insurance is having in the region.
Mandatory health insurance obviously has been rolled out now and is it's causing a lot of work for insurers, intermediaries, but I think it's massively important, ensuring a consistency of care for residents across the UAE now with the imposition of HAD regulations and now DHA. I think that's paramount. What has also, I think, been very important for the industry is the increased importance of competence within the marketplace and standards within the broker market and indeed the provider market.
With mandatory health insurance being implemented in the GCC, insurance companies have great opportunity now because they know that the market is open and they will have to compete. This is great for providers. They know that there is now potential for them to invest. In Optum, we believe this is a good time for us. Optum provide technology for both healthcare providers and insurance, and technology can help scale the businesses. So in a market where insurance penetration was low a few years ago, they could still do the business with pen and paper, sending faxes and etc. But when the whole market now talking to each other, we come in the middle and implement technologies that have them talking and automate the process on both sides. So the way a customer or a patient visits a hospital, how he does his registration, eligibility check, and then how that change from historically being a paper fax to the insurance or a phone call, and the patient has to wait until they take approval. We bring in automation to the game, and they can just press a button, send the request to the insurance company, and from the insurance company side, instead of hiring people who would look into those requests, we built in automation rules that will answer in fractions of the minute or seconds, and then here you go. That's a better experience for the customer, which is very important, and this is the name of the game. But at the same time, that provides efficiencies for both sides.
In other news, the Roads and Transport Authority has installed CCTV cameras in taxis as part of a pilot project to monitor the performance of drivers and for general security. According to a local report, each taxi has been equipped with 3 tiny cameras, one installed near the center mirror of the vehicle, covering only the driver, while the other 2 are set up at the front and rear of the taxi externally. Abdullah Yusuf Al-Ali, the CEO of Public Transport Agency, was quoted as saying that the installation of cameras in taxis is a project under trial. The project has been ongoing over the past 6 months. Until now, a few taxis have been equipped and are now testing the system with different types of cameras to get the best results. He added that the RTA is yet to decide if all taxis in Dubai, including those operated by franchisees, will have the cameras. The CCTV cameras will provide feed to the Transport Authority's control centre. The pilot phase is expected to last a few months, and during this period, feedback will be taken from drivers and passengers. Buildings in Fujairah will soon have a 10-digit geographic address and be part of the e-address smart system Makani. Dubai Municipality and Fujairah Municipality on Tuesday signed an agreement to enact the Makani system in Fujairah. Makani, or My Address, will enable people to locate buildings with an accuracy of 1 meter by using a quick response code for buildings in the Emirate. His Excellency Hussein Lutha, the Director General of Dubai Municipality, stated that the Makani system would be enacted at all government and private buildings for the use of everyone in Fujairah, adding that the system will be made available on all smartphones and smart devices in the future. Under the agreement, Fujairah Municipality has the right to use Makani's signs and data for the Emirate, while Dubai Municipality will provide training and technical consultation. Last month, Dubai Municipality said the project, which will be rolled out in phases, would cover 40,000 buildings in 58 areas of Dubai. The system has been enacted at metro stations. It will also be used by government agencies such as Dubai Police to provide an accurate location of incidents to emergency services. And finally, in the bulletin, the Pink Caravan Ride, a pan-UAE breast cancer awareness initiative by the Friends of Cancer Patients, is calling on Emirati medical practitioners to join its 6th annual ride, taking place from the 7th to the 17th of March 2016 across all 7 Emirates. Registration runs from January 28 to February 11, and the requirements for doctors are that they practice general medicine, family medicine or radiology. It is also calling upon nurses and X-ray technicians to join them. For the first time this year, electronic applications are also being accepted through its website, pinkcaravan.ae. Last year, during the 10-day ride, 30 clinics were set up across the country, offering free breast cancer screenings, with the participation of approximately 150 doctors, 67% of which were Emiratis. They accompanied the 150 horse riders and 100 volunteers of various nationalities who travelled across the 7 Emirates, kicking off from Sharjah, passing through Fujairah, Ras Al Khaimah, Al Quwain, Ajman and Dubai, eventually finishing off in Abu Dhabi. According to representatives, a training workshop for the medical teams will be organised to ensure they are completely ready for the 2016 ride. Breast cancer is the most common type of cancer in men and women in both developed and developing countries. It accounts for 16% of all cancer causes among women and causes the death of approximately 410,000 women every year. According to statistics, 98% of cancer cases, if detected early enough, can be treated and completely cured.